Good. Hi, my name is Race. I'm an RT student. I'm doing an MDI competency. I'm going to be using my MDI, spacer, peak flow, and stethoscope and pulse ox. Before you go in the room, you want to know the patient's name. You want to know the doctor's orders. You want to know, any past x-rays. You want to know how long the patient's been in the hospital. You want to check vitals for trends, any past trends. You want to, just get to know the patient. Any family members, you want to make sure you have your equipment ready, and you want to be, you want to wash your hands when you walk in the room, Okay, so now I'm going to walk in the room, Boom, boom, boom. First thing you want to see is the patient's impression. You see the patient. Is the patient breathing heavy? Is their consciousness altered? Their skin color? See the distress. So patient walk in. Hi, how you doing? My name is Rich RT.
Daniel.
You Daniel? Okay. I'm here. Your doctor ordered a albuterol treatment. What albuterol is, it's going to help your lungs open up wider. It helps you breathe. How are you breathing right now?
It feels a little chest tightness, a little hard.
Little chest tightness? Okay. We'll get that situated. Can I see your first and last name, please? Daniel Smith-Owen, right?
Yes.
Okay, cool. Let me see. And date of birth?
November 29, 1993.
Okay, boom, verified. That's the right patient, okay? And the right time, right? Time to give the meds. Whatever. Okay, cool. All right, so albuterol. Before we start, have you taken albuterol before?
Back in the day when I was younger.
Oh, back in the day when you had asthma?
Yeah.
Cool. So that's probably in the chart too. Okay, cool. I'm going to start with vital signs, okay? All right. So, or you can tell the patient, so vital signs is fine. You can start with vital signs. Okay, the he's sitting down into the bed. He probably wasn't get up. Before I got in the room, looks like he can get up. Anyways, talk too much. There we go, pulse ox. Let's get us in you on your finger. I'm gonna check his lungs. Okay, no. Alright, so I'm gonna go and check your lungs, alright? Okay, cool. Go and take a deep breath when I tell you to. Go ahead and relax for now. It's good to have, just skin to skin, but it's fine. Go on, breathe in. There we go. Breathe out, then breathe in, breathe out, and then breathe in, breathe out. Then breathe in, breathe out. Okay, make sure when the patient breathes in, you want to see it there. You want them to do the full tidal volume. Okay, so you get the full exhale, inhale. So this patient, he's heard wheezing, right? If he's having trouble, it's indicated, right? Wheezing at the lungs, almost bases of the lung, with the not top of bases. Now I'm gonna check his blood pressure. So how's his lungs? He has a watch on. That's fine. Let's go this side. Check here. I count for 30 seconds. Then from there, after you count 30 seconds, you just hold that position and count the respirations. 30 seconds. Patient has no clue if you count the respirations. So, let's say you're having distress, it's above 100 right now, right? It's above 100, right? It's indicated, hopefully it's indicated, hope it's not indicated, right? That'd be good to not see indication, but it's indicated, he has a high pulse, his BP was, let's say 145 over 80. All right, his pulse over, it's 120, so he's 120, so he's tachycardia, he's breathing heavy. Thumbs up, that's a good sign. His pulse ox reading was at 97. So that's good. So he's having a hard time to breathe. His breathing is causing all these, increased heart rate. Okay. All right. So you're breathing kind of heavy, but it's fine now. So albuterol's gonna, we'll get to this later. Go ahead and breathe into this. This is the peak flow. It's pretty much it's based on your patient's age and weight, and I think sex, like male, female. And the predictive values here. So the patient breathes out, say he's 5'8", 5'9", his value's 400, let's say it's 400. I think it was when I checked. So patient's gonna breathe in and hopefully get at that mark, if not, get close to that mark, okay? So this is the pre-numbers that are vital to know. Go ahead.
Just take a deep breath.
Yes, sorry. Yeah, so you wanna go ahead and take a deep breath. and breathe out as hard as you can, okay? We want to see how good this drug works, because once you leave out of here, I mean, if it don't work, you want to come back. Breathe in and breathe out. Good. Boom. That's the number. Great. You know, it's 390. Go ahead. So he does this 3 times. If you think the patient's going to retry the heart, have him do it again, because you want accurate numbers, so it's accurate, right? Okay, then he does it again. Oh, sorry, I did it. Try to go fast here. Let's go home. Anyways, patient. Third time, great. You know, let's say it's 350. He's below his value. Okay, so you write this down, 350. Then from there, you go ahead and I guess teach the patient about, you know what, I'm gonna, okay. I feel like I just want to give it to him because he's having distress, but I'll go ahead and talk about it before I give it to him. I'll watch him struggle breathing. No, I'm kidding. So this is albuterol. Once you get it, it's gonna, side effects are it's gonna make your heart pump faster. Okay, it's like having coffee. So your pulse will go up, blood pressure, your pulse will go up. It's fine. It's normal. Okay. I'll be monitoring your pulse throughout the whole thing. Okay, that's totally fine. So you breathe in here. You breathe. Go ahead and breathe out. Then once you breathe in, you push the button. You auscultate it, and then you hold your breath for 10 seconds if you could. Then you breathe out through your nose. Okay, that's how you use it. Go ahead and give it a try. Do you have any problems coordinating? You think?
I think it'll be okay. So just use this by itself? Or?
Yeah, just use it right. Okay. Yeah, so you use this here. I'll do the whole thing. Okay. So if it's brand new, let me get down. If it's brand new, you want to auscultate it. Okay. If it's been a long time since you used it, you want to do an auscultation. Shake it, and you auscultate. Okay. So yeah, and before you, so if it's been a long time since you used it, you want to shake it and squeeze. Also, what's important too, before you use it, you want to make sure it's warm. There's medicine in here, you want to make sure it's mixed well. You got to mix stuff, shake it, do whatever, shake it here. Get the medicine nice and mixed. And from there, you just put it down here. And then you breathe out in, hold for 10 seconds, and breathe out through your nose, okay? After you do that, you want to, just wash your mouth out, because there's medication in your mouth, you want to just wash it out, okay? Let's see how well you do. If you have problems, coordinating the medication to your mouth, I'll go ahead and get you one of those spacer. Okay, but let's see how you do. So that's how. So, do you have any questions before using it?
No. I'll go ahead and use it.
Okay.
Just breathe out.
You breathe out. Go ahead and look up a little bit. Hold on at least 10 seconds. If not, hold it as long as you can. Then from there, you breathe out through your nose. Okay. Okay. So this is a rescue drug. Okay. It's used for your attacks, asthma attacks. If you have any asthma attacks, if you use it more than 4 times a day, that's kind of too high. That means he's having continuous episodes of asthma attacks. Okay. So come back to the hospital. We'll give you a longer lasting drug. So this is your rescue drug, okay? So again, use it more than 4 times a day, that's too much, okay? Come back here, we'll give you another drug so you'll be able to sleep better and be able to run and do normal things, whatever. Yeah, so this is it. And how'd you, was it easy for you to, it looked pretty good when you took it.
I feel like it's, I noticed there's another tool over there. Can you explain?
Okay, sure. Yeah. This is a spacer. So what's good about this is when you take this normally without a spacer, you gotta push and breathe in at the same time, right? Spacer, what this does, it allows you to push the button out, push the medicine out. Then that medicine, it just sits there, okay? So opposed to just timing it, the gas sits here, it waits for you. So now you can just get ready for it. You just breathe out and then breathe in. So the medicine just sits there and waits for you. So it's easier. That's why it's easier. It's better coordination. It's better, just easier use. when you wash it, when you wash both of these, when you wash this, you want to just use warm water, whatever, soap, whatever, and just warm water, soap, and just let it air dry. This here, same thing, water and soap, but this you don't want to clean the inside. It creates like a static and it attracts the medication inside. So just let it air dry, no rub. Well, yeah, this one you can just clean and whatever. So great, I explained the patient. Want to explain this to me, I guess? Sure, go ahead and go ahead.
Okay. You see what that was?
Yeah.
So I just pop it in, make sure it's checking. Okay.
Yep.
And then so just once I press it, it stays in there, and then I wait to inhale.
Yeah.
So I'm just gonna go ahead and try that real quick.
Good.
Press it.
Boom. You look up a little bit. 10 seconds, try to hold it 10 seconds, if you can't, just do as long as you can, then breathe out through your nose. And two auscultation. You take two of these. You want to take 2 doses of that, okay?
Okay.
Cool, okay. Now, how do you feel you breathe and how do you feel?
I feel like there's more air in it.
Okay.
I'm able to take deeper breaths.
Okay, cool, that's good. I'm gonna go ahead and just check vitals again. Patient will be able to tell me how to work the device, that's important. You want to make sure the patient goes home without knowing what to do, okay? Okay, cool, there we go, thank you so much. Hey. All right, I'm gonna go ahead and check your lungs again, okay, sir? Here. Breathe in, breathe out, boom, breathe out, breathe out. I'm just going fast because, I already told you what you want to do before you want to make sure the patient goes tap full, in and out, expiration, respiration, and make sure you hear it, okay? You don't want to just skip spots. I'm just going fast just because he has to go home. Thank you. Great patient today. Justin. So reasons went down, which is great. Shows a good sign that his medications work. Now I'm going to check his pulse. Here. Count for 30 seconds. His pulse stayed the same, 120. We count for 30 seconds, so you got 60, and then times 2, 120. Stayed the same, but at least it should go down soon. Respirations, wait an extra 30 seconds, you count, you times it by 2, and his respirations went down. It's a good sign that medication works. Good sign. Cool, that's great. I'll get pulse ox. I'm sure pulse ox is pretty good too. Skin color looks well, patient's skin color looks good. He has no nail polish or anything like that, so pulse ox can get Cool. Patients was at 98. That's pretty good. He's healthy. His pulse was identical to my reading, so this device works well. Last thing, I'm gonna have you do this again 3 times. Leave it as hard as you can. Take a deep breath 3 times. You want to do 3 good times and take the best one out of those 3. Boom. Let's say you did that 3 times. Good. Wow. Look. Your values went high. You want to see a 20% increase in value. So then after that, you get the numbers. you get your numbers. So it's the post. Your post minus pre divided by post. Then you get your number, and you see the increase, the patient increase in their expiration. Then from there, you ask the patient, "Do you have any more questions?" You look really good.
No, I think I have a good understanding.
You build trust with the patient too. Eye contact, right? That's good. So yeah, explain. I'm not sure if he's getting discharged or not. Who knows? I don't know. But let's say you can discharge. I'm not sure. You tell the patient this you'd be taking this home and this home with you, and then yeah, and from there you just give them the devices, and then that should be it. You tell the patient, if you have any questions, just tell the nurse. Then she'll call me. If you're still here, I'm not sure the discharge. I'll come back and say hello, see how you're doing, okay? Is that good? Do you have any more questions? Okay, check, okay. Cool. Right, patient sitting down. It's kind of funny, right? It's the patient sitting down. Usually they're laying down in bed, we walk in the room, they're sitting down. Why don't you, we want to get up?
Well, no, I'm
Fresh room?
I believe I was gonna get discharged pretty soon.
Okay, so I must have missed out on the chart. See that? Okay, cool. All right, well, hey, thank you so much, huh? Okay, all right, good. You looking good, man. All right, take care. And walk out.